Hello and namaste to all of you. This is Name-Shalu Singh from Department of Physiotherapy and Diagnosis from Jayoti Vidyapeeth Women's University. In our past sessions, I've talked about acidosis and alkalosis, which are the major acid-base balance disturbances. I've already told that normal levels of your body pH is 7.38 to 7.42, or at an average, we can say it is 7.4. If there is fall in pH, that is decrease in pH from 7.38, it will lead to your acidosis. And if there is further even more fall in pH, this acidosis or alkalosis condition, it can also be life threatening and it may lead to your death. And alkalosis is the condition which will be caused when there is increase in your pH above 7.42. And further, if there is increase in pH from 7.6, it is also life threatening and it will lead to your death. Now, these acidosis and alkalosis also have discussed that these acidosis is of two types: metabolic acidosis and respiratory acidosis. Uh, a metabolic acidosis I've already talked about in detail, and it has like metabolic acidosis, it has primary deficit in bicarbonate, and it has of two types: high anion gap metabolic acidosis and normal anion gap metabolic acidosis. In case of respiratory acidosis, there is primary excess of your carbonic acid. Now the next type is your metabolic alkalosis, of which metabolic alkalosis also I have discussed in earlier sections. There is primary excess of bicarbonate in case of the metabolic alkalosis, and in alkalosis, respiratory alkalosis, there is deficit of carbonic acid. In case of there is acidosis and alkalosis, their responses can be compensatory response and your mixed response. Or also in case of metabolic acid acidosis, I've talked about one of the major terms, which is your anion gap. And after anion gap, this metabolic, there is one of the also the major term, which is called a osmolar gap. Now, after metabolic acidosis and metabolic alkalosis, the one of the major acid-base disturbance that comes up is your respiratory acidosis. Now, when we say respiratory acidosis, respiratory means it is related to your lungs, right? So, if there is, for the definition of respiratory acidosis, there is excess amount of carbonic acid. So, the amount of carbonic acid, it is either getting increased, or the secretions of carbonic acid is getting increased, or either it is not getting metabolized, this carbonic acid. So if it is not getting metabolized, it is not getting used up in your body, so it will increase in your system. So if anything that is not getting excreted out or it is not getting used up, so it will definitely increase in your system. So primary excess of carbonic acid, it will be your cardinal feature. It will be your most important feature, the excess presence of your carbonic acid. So why will be what could be the possible reason why carbonic acid is getting increased in your body? So first of all, it can be due to carbon dioxide retention. So if carbon dioxide is continuously getting accumulated, so it will combine with H2O and it will form your carbonic acid. Okay. So if there is continuous retention of carbon dioxide, so if there is carbon dioxide accumulation, so and there is that means there is no intake of oxygen, right? So it will cause hypoventilation. Hypoventilation means there is the breathing rate is getting slow. Hypoventilation is the term where hypo means less, and ventilation is your breathing rate, the ventilation term that we used for exchange of air within your rooms and all. So that is called a hyperventilation. Now, the ratio of bicarbonate to carbonic acid, it will be less than 20. During your bicarbonate buffer system, I've already discussed that the ratio of bicarbonate to carbonic acid is always 20, which I've then also I told you that it is the very important value, and you'll come across this several times. So it is very important to know, or very important to remember this value, that the ratio of bicarbonate to carbonic acid is always 20. So in case of respiratory acidosis, this ratio, it gets less than 20. So depending on whether the condition is of acute or chronic onset, the extent of compensation will vary. Now, in case of acute respiratory acidosis, it may result from your bronchopneumonia or status asthmaticus. Now, if there is like, because since respiratory acidosis, it is linked with your lungs and all. So in case of acute symptoms, if when there is not too much of acidosis, when there is, it is not a critical situation, it can be due to your pneumonia, okay, or maybe in case of your asthma patients. So nextly, in case of depression of respiratory center due to overdose of your sedatives or narcotics, okay. So in case when a respiratory your respiratory center is getting suppressed, or it is getting depressed, okay, due to some if in those cases, when people take antidepressants, or when they take drugs like narcotics and all, there is this case of depression of respiratory center. So in case of major overdose of drugs like sedatives, when people are taking antidepressants, sometimes uh, they get overdosed, right? Or in case of drugs also, you there are always the cases of overdosing of drugs. So in those cases, there'll be a case of hypercapnia, okay. Hypercapnia, that is increase in carbon dioxide levels. Hyper means increase, and capnia will stand for your carbon dioxide, okay. Now, the chronic obstructive lung disease, it will lead to chronic respiratory acidosis, where there'll be fall in pH and it will be minimal. So, any findings in chronic and acute respiratory acidosis, there will be, which I have already discussed earlier. Now, when there is excess carbonic acid, so it will be buffered by a hemoglobin and a protein buffer system, okay. So earlier also I've told you that in case of hemoglobin, there is exchange of carbon dioxide, water, and your bicarbonates. There is complete buffering. And your, in case of your protein buffers also, there will be buffering of your carbonic acid. So this could be there could be a slight rise in bicarbonate, and kidneys will respond to your conserving bases, okay. So now excreting hydrogen as NH4 plus, and in your chronic cases it will be well compensated, and unlike acute cases, okay. So in case of respiratory acidosis, bicarbonate level is increased, that is it won't be decreased. This bicarbonate level in case of respiratory acid, it will be increased in here in this case, okay. Now clinically, let's talk in a clinical presentation, there will be that patient will show decreased respiratory rate. He or she may have breathing problem, heavy breathing can be there. So decrease in respiratory rate can be there. Hypotension, low BP can be there, okay, or person can be in case of coma. So hypercapnia, it may lead to peripheral vasodilation and your tachycardia and your tremors, okay. So any finding in case of acute chronic and acute respiratory acidosis, which I will be telling you later. Now the renal compensation will occur, generating more bicarbonate and excreting more of your hydrogen. Now, uh, talking about lab finding of respiratory acidosis. In case of acute respiratory acidosis, there will be a decrease in pH, increase in PCO2, or it can be having normal or increased bicarbonate levels. Okay, or further, in case of chronic respiratory acidosis, there can be decreased pH, increase in PCO2, and increase in level of bicarbonate. Now, what can be the major here in case of respiratory acidosis? These bicarbonate levels are present now. Maximum limits of compensation can go up to 32 millimoles per liter, and the causes of this disturbance, which if I say the respiratory acidosis, so it can be respiratory acidosis. I have already told you it can be pneumonia or your asthma. Late more other causes can be either can be a bronchitis, your COPD, your pneumothorax, narcotics and sedatives. They can also cause your respiratory acidosis, the paralysis of your respiratory muscles, central nervous trauma, and tumors, your ascites, your peritonitis, and sleep apnea. So these would be the causes for your respiratory acidosis. So this was all about respiratory acidosis. So in our later classes, I'll be further talking about respiratory alkalosis. So until then, if you find any difficulty, or if you don't understand any topic, if you have any doubts related with this topic, or any doubts related with your last topic, feel free to talk to me, and I'll definitely try to clear your doubts. So until then, take care and good.